Welcome to USMLE World, where we ask, answer, and explain USMLE questions. Today, we're diving into Step 2, Internal Medicine, focusing on GI and nutrition. Let's get started with question number 1. For the following case, which of the following is the most likely diagnosis? A. Anorexia nervosa. B. Avoid or restrictive food intake disorder. C. Bulimia nervosa. D. Pellagra. E. Rickets. F. Scurvy. The case scenario is: a 23-year-old woman comes to the emergency department due to right wrist pain after a fall. The patient fell onto her outstretched hand while walking across the floor at a gym where she exercises regularly. She has no significant medical history and takes no medications. The patient says she has tried several diets to lose weight and is currently consuming a vegan diet. Her last menstrual period was 3 months ago. She does not use tobacco, alcohol, or illicit drugs. Temperature is 36.1 degrees Celsius, blood pressure is 90 by 58 mm mercury, and pulse is 50 beats per minute. BMI is 18.3. Weight is 50 kilograms and height is 165 centimeters. Physical examination shows tenderness and swelling over the distal radius. The parotid glands are enlarged and there are fine, soft hairs on her extremities. Urine pregnancy test is negative. X-rays reveal a non-displaced fracture of the right distal radius and generalized radiolucency of the bone. The question is: which of the following is the most likely diagnosis? Your options are: A. Anorexia nervosa. B. Avoid or restrictive food intake disorder. C. Bulimia nervosa. D. Pellagra. E. Rickets. F. Scurvy. You have 15 seconds to type your answer in the comment box. Congratulations if your answer is A. Which is anorexia nervosa. This question is designed with the focus to assess your ability to make a diagnosis. This patient has a fragility fracture, which is fracture due to low-energy trauma, and radiolucency of bone on X-ray, suggesting osteoporosis. In light of her restricted diet, thin body habitus, and cessation of menses, this is likely due to a low estrogen state and functional hypothalamic amenorrhea. Excessive exercise or weight loss suppresses secretion of gonadotropin-releasing hormone, leading to decreased release of FSH and low estrogen levels. She also has vital sign abnormalities, bradycardia, low body temperature, and lanugo, fine, downy body hair, that together raise suspicion for anorexia nervosa. Anorexia nervosa is characterized by restriction of energy intake below that needed to maintain normal body weight, BMI typically less than 18.5, leading to an emaciated body habitus and clinical features of starvation. Patients with anorexia nervosa have a distorted body image and an intense fear of gaining weight or becoming fat. Common behaviors include excessive caloric restriction, intensive exercise, and binge eating or purging. Self-induced vomiting, misuse of laxatives or diuretics. If you choose any option other than A, you are wrong. Let's briefly discuss the other options. B. Avoid or restrictive food intake disorder. Avoidant or restrictive food intake disorder is characterized by inadequate food intake due to lack of interest in eating, dislike of the sensory experience of eating, or concerns about the consequences of eating without an associated disturbance in body image. This disorder typically presents in childhood or adolescence, and patients do not have signs of recurrent vomiting. Parotid hypertrophy, as in this patient. C. Bulimia nervosa. Bulimia nervosa is characterized by recurrent binge eating or purging and preoccupation with body image, much like in many patients with anorexia nervosa. However, patients with bulimia maintain their body weight at or above the minimally normal level and do not experience the signs of starvation that are present in this patient. D. Pellagra. Niacin deficiency. Is characterized by dementia, dermatitis, and diarrhea. E. Rickets. Vegan diets, which are free from animal products, can increase the risk for deficiencies of vitamin B12, calcium, and vitamin D. Vitamin D deficiency may lead to low bone density and fragility fracture. However, rickets involves deficient mineralization and disruption of the growth plates and only occurs in children. F. Scurvy. Vitamin C deficiency. Is characterized by skin and mucosal hemorrhages, intra-articular bleeding, gingival swelling, impaired wound healing, and weakened immune response to local infections. Vitamin C is readily found in plant products. A vegan diet would not predispose to scurvy. Your take-home message from this question is that Anorexia nervosa is an eating disorder characterized by low body weight, intense fear of becoming fat, and distorted body image. Medical complications due to starvation in anorexia include bradycardia, hypotension, osteoporosis, and amenorrhea. Nailed the answer? Great! Click above to level up. Still learning? Rewatch and get it right next time. Understanding is your key to success. Unlock your USMLE and medical exam dominance with our awesome resources. Share the knowledge, hit that like button, and subscribe for medical exam mastery. Your future doctor self will thank you.